Welcome everyone. As you're coming in, we'll just get started in a minute while everyone gets situated. Take a minute for everyone to get here because we have almost 170 people who have registered for this event today, which is pretty exciting. Okay, so the flow of joining has slowed, so I'm going to get started in the interest of time because we have an hour and 15 minutes to cover a lot of ground. So it is with great pleasure that I welcome everyone here today. My name is Angie Buckner, and I'm an assistant professor in the Department of Public Health and Recreation. In our department, we're really committed to preparing leaders who promote health and improve our communities. And we really value the essential role and our responsibility in being advocates in our communities. We also value and appreciate and invite opportunities to engage and connect with our community and community members. And this event today really honors these commitments. So, of course, none of this would have been possible without the planning efforts of the Career Exploration Committee and our student club. So thank you so much to everyone who has worked so hard to organize and promote these events. Before I introduce and we get started with our guest, I just have a couple of real quick announcements. So the first one is today's training is being offered this week because this is National Public Health Week. And this is our effort to participate in these national events that are organized by the American Public Health Association and have been for the past 50 years. So today is our second event, and we have two more. So for everyone who's here, I hope that you'll consider joining us for a conversation about local politics tomorrow with County Supervisor Cindy Chavez. And then on Friday, we have a networking event for public health and recreation students who will have an opportunity to meet with and talk with local professionals. And you can register online. During the webinar today, if you have questions, please post your questions in the Q&A. And we will do everything that we can to address your questions either today during the event, live, via the Q&A chat, or we will follow up with additional information as needed. And with that, I'd like to introduce my colleague, Dr. Vicky Gomez, who's going to be facilitating the event today. And thanks again, everyone, for coming.
Thank you so much, Dr. Buckner. I am so excited to welcome you all to today's National Public Health Week, focusing on the importance of advocacy in our field. Today, I have the honor of introducing my co-researcher and my friend. Darcie Green is a lifelong resident of San Jose and brings over 20 years of community activism and public policy experience. Darcie is currently the executive director of Latinas Contra Cancer, which exists to create just and equitable access to health and healthcare for the Latinx community around issues of cancer. Darcie is a nationally certified patient advocate. While working for a nonprofit health insurance and hospital system, Darcie led local efforts on health policy, often bringing together unlikely allies and resources in order to support improved health outcomes for uninsured or underinsured populations. Prior to entering the nonprofit and healthcare sectors, Darcie worked as a field representative in the California State Legislature, where she helped to address many public policy issues affecting the residents of San Jose, with a particular emphasis on access to health and quality public education. Last but not least, Darcie has served for 4 years in appointed public office positions and 6 years in elected public office, serving on her local school board, County Board of Education, and the County Commission on the Status of Women. She has won many awards for her community and advocacy efforts. Please join me in welcoming Darcie Green.
Thank you. So I'm so honored and excited to be here. Let me share my screen. I can pull up my presentation. Advocacy of any kind is so important and crucial in our communities. And let me see here. There we go. Perfect. And advocacy within the healthcare space and in the public healthcare space is particularly important at this time. So Darcie Green, my name, I'm the Executive Director of Latinas Contra Cancer. Down here, I have some titles that I'll go over. One is Community Health Advocate. That's what I am now in my professional career. Abolition Advocate is what I do in my personal time, my volunteer time. Social and Racial Justice Advocate is the overarching advocacy umbrella that I advocate under. And I also listed down here some identities, because when we think about how we show up to advocacy and what we have in our luggage and our bags when we show up as an advocate in the community, our identities often help to shape the opinions and the beliefs about the world that we have. Our identities are often what help to form our experiences or influence our experiences that we bring when we show up as health advocates or as advocates in general. And our identities often are the lens from which we view the world and also impact the way we might feel about certain issues or what we know to be true about certain issues. So in addition to being a community health advocate, an abolition advocate, and a social and racial justice advocate, I am a mom, I am a daughter, I am a sister, I am a Latina, and I am an East Sider. And those of you who are from East San Jose will know that that's a very important identity that has helped me shape my advocacy, why I choose to advocate for the issues that I advocate for, and how I show up as a community leader in my professional and personal career. What is advocacy? So this is not a formal definition. This is just as I was thinking about advocacy and if I had to define advocacy just using my own thoughts and had to define to somebody who maybe didn't know what it was, I came up with this: a process of engagement that creates the space for us to be an active participant in the systems that govern and impact our lives. And when you think about that definition of advocacy, as I put it, and there are many definitions that are similar to this, I encourage you all to go out and research and look up the different definitions of advocacy and think about what advocacy means to you. The reason I came up with this definition for advocacy is a few reasons, and I'll take each piece of this definition apart. One is a process, right? Advocacy is a process, right? It's a process that we put in place. Many different systems, agencies, nonprofits, neighborhood associations, lobbying groups all have a different process for how they might advocate for something. And that's determined by whoever's doing the advocacy. We can have a personal process for how we advocate. Some are effective and some might not be effective. But the point is really coming up and knowing that advocacy is not just a one-time, 1 second thing, although maybe sometimes it might look like that. Advocacy is a process. It's a process of what? It's a process of engaging. It's how we interact. It's how we show up. It's the way that it's the vehicle that allows us to engage with something. The advocacy we're talking about today, the advocacy I've been involved in, has been community advocacy, has been advocacy around civic participation, advocacy around public policy, advocacy in our community. So the type of engagement that I've been engaged in since I was very young, as you'll see later on in our presentation, is creating the space for me to be a participant in the systems that impact me. Creating the space. When I thought about how to phrase that, there were many ways I was thinking about how I might phrase that. Something that allows us to advocate, something that allows us to participate. But when I think about the type of advocacy that I've been involved in and the type of advocacy that I know to be effective, the type of advocacy that I know to be effective doesn't passively allow, it actively creates. It creates space where there was not a space. It takes a space. It demands a space. When I think of advocacy, I think of the creation of a space, holding people in that space, for us to be active participants in the systems. So advocacy, we know, is process of engagement, creating the space where they may not have been a space, for us to actively participate. And there's many definitions of what actively might mean. And that might vary, depend on who's doing the engagement and what communities are engaging. But actively participating means not simply just listening, not simply just giving your feedback and then leaving, but a process that allows you to be an active, engaged participant in that system. And we'll go into what that might look like in real life situations. And the systems that govern and impact our lives. And when I try to think of what would be broad enough of a way to phrase that. Systems that govern and impact our lives. And I encourage you right now, as you're listening to me, to think of the systems that govern and impact your life. A system could be something very, very local scale, right? It could be a homeowners association, right? They have a system and that's impacting your life. It could be a system on your school campus that's governing and impacting the way you interact as a student. It could be the state legislature that's passing and creating laws and allocating resources that govern in the way that you are able to live your life. It could be the DMV. There are systems everywhere. There are recognized systems, right? Systems of patriarchy, systems of white supremacy. There are those types of systems that we fight against. There are systems like the DMV, systems like the education system, the healthcare system, and then again, these more localized grassroots systems. There are systems all around us that are moving and growing and are active every single day. And they're transparent, they're like the air, but they govern everything you do. They decide where you can drive, where you cannot drive, where a park might go, where a park might not go, where affordable housing can be built, where affordable housing won't be built. They govern everything, where a school might be built and what's offered there, where a school might not be built, what might not be offered there. There are systems that exist that are there ever present, governing the way that we live in this world. Those are the systems that advocacy can impact and should be the target of advocacy, although there are some other advocacy that are even more micro than that we might discuss later on. So that's when I thought of the question, what is advocacy? That's what I came up with. Why do we do advocacy? Again, I encourage you to do your own research on this. These are my thoughts on why one might participate in advocacy, why do it, what comes from it, what becomes possible because of it. Well, number one, for me, based on the type of advocate that I am, centering the voice of the people. Quality advocacy, effective advocacy centers the voice of the impacted. When you think about the systems that we just talked about, let's just take the healthcare system, for example, impacting the voice of the impact or centering the voice of the impacted. If I were a patient advocate, which I am, I would want to center the voice of patients, right? So my effective advocacy for me as a patient advocate would be ensuring the voice of patients are centered in those systems. Fighting for social justice, a great reason to advocate. There's an issue you're really fired up about. There's an injustice happening. We saw a lot of that in this past year with reimagining policing, defunding the police, with advocacy at the border. There's these social injustices happening. There's racism happening. There's economic disparity happening. There's all of these social ills that are happening. You might be moved to advocate to do something about that. Impacting public policy. Advocacy is a way to impact public policy. Sometimes it may look like lobbying, but many times it's not. And there are many different ways that you might be able to impact public policy. Dismantling harmful and racist systems. This is a great reason to advocate. Progressing I'm sorry for the typo there, progressing a set of community values. This is getting more into this idea of advocacy through organizing, which we'll talk about a little, and you may have seen in the flyer I sent out was hopefully sent out to you or will be sent out to you, a list of PICO principles there around organizing. Advocacy can help to progress a set of community values. Right now I'm involved in advocacy around policing or advocacy around healthcare. I belong to communities of people, and we'll talk about that, about how do you decide what communities you belong to or natural belonging to communities. And there are values that we hold, and we want to progress those values in our city or progress those values in our community. So we're going to advocate and use this process of advocacy in order to progress those values we share. Educate on an issue area or policy area. Maybe it's you who wants to do the education on the public policy area. I do a lot of advocacy around education, making sure people understand what universal healthcare is, making sure people understand what single payer is, understanding healthcare systems. So educating on an issue area is another reason you might want to use advocacy as a process. You may want to influence the spending of public dollars or allocation of public resources. You may want to advocate around a city budget, a county budget, a state budget, a school budget. The allocation of resources is a really important system to understand wherever you are and whatever system you're operating within, and advocacy can help to influence that. And I have this question here around others, because these are just some reasons to advocate. These are some of the reasons that I advocate. These are some of the reasons I have advocated in the past. So I'm not suggesting anything I have not done myself. And these have all been pretty solid reasons to advocate. They are not exclusively the only reasons. There are many other reasons that you might come and show up as an advocate in the community. How does one become an advocate? So first, I'd like to pose the question, maybe you already are, and it's a question because that's something you'd have to ask yourself. I would argue that you probably already have done some advocacy in your lifetime, and maybe you already are an advocate. There's a PICO organizing principle. I was a PICO trained community organizer as a youth leader way back when. And there's a wonderful set of principles that help us to think about the ethics and integrity behind organizing and community advocacy. And one is that power is the ability to act. This is a principle I learned at the age of 14, and it changed everything for me in understanding that I already possess the ability to advocate. I already possess that power because I have the ability to act. Now, whether or not I choose to do that is up to me. But as a 14-year-old Latina in East San Jose, I was very clearly told that I had, or I was helped to learn from myself that I had the ability to act. Therefore, I, as one person, had power in our community. So I share that with you and ask you to think about, in what ways do you currently advocate? At school, have you advocated for yourself at San Jose State? Have you advocated for yourself in admissions? Have you advocated for yourself with scholarships? Have you advocated for yourself to overcome obstacles having to do with your education? For your parents, for your siblings, for your family? Have you ever advocated for your parents in a system maybe, or maybe for a sibling, maybe for a family member? Have you helped them to advocate? It could be advocating for themselves on the phone with an operator somewhere, or maybe someone in medical billing, or maybe it was someone at the DMV, or maybe it was in any of these systems. Have you advocated for somebody or yourself? How about in healthcare settings? Have you ever gone with a family member or a parent to a healthcare setting to help them advocate? Within other systems, right? We've talked about health education, we've talked about, healthcare, we talked about public education. There are many other systems that maybe you've already done some advocating in. And that knowledge and wisdom is really inherent in you. And especially here in this area where we know many of us ancestrally, generationally come from communities and populations that have effectively advocated for themselves over time within systems. How is that passed down? And what lived experience do you have that you bring to the table? Whenever I meet people who talk about wanting to become a leader, or wanting to become an advocate, or wanting to become an activist, surely there are ways to sharpen your tools. Surely there are ways to learn and grow and to do things more effectively. Even at this stage in my life and career, I am always in search of new and better, more effective ways to do the work that I do. But I also remember that I bring with me this knowledge and experience. So I'd like you also to think about what you already bring to the table, and in the ways that you, as I would say to people who ask about wanting to become an advocate or become a leader or become an activist, to recognize the many ways that you already are one, and start from that point. You may want to grow into a different industry of advocacy, or a different policy area of advocacy, or within a different system in order to be an advocate there. But I assure you, there's probably ways you already have shown up in your life as an advocate. Advocacy as a volunteer. So now that we've established that we're all already advocates, and we're probably pretty good at it, there's a few ways you can deepen that commitment to advocacy. One would be advocacy as a volunteer. So after you've thought about the ways that you've already shown up for yourself or your loved ones or others as an advocate, in maybe smaller or big ways, deepening that advocacy, formalizing that advocacy could be through the route of volunteerism. And the way to start about that, what are you passionate about? Are there issues you really care about? What problems do you want to fix? What injustice do you want to make right? When you look outside, and I'm sitting by my window here, when I look outside my window, when I look into my neighborhood, when I'm driving to school, walking to school, driving to work, walking to work, taking a walk around the block, are there things that I see? When I talk to my neighbors, are there things that I hear that are not right, that I want to make right? What's your personal connection to this work? When you start to narrow down, what are the issues that light you up? What are the issues that you think about? And then what's your personal connection to it? Does it impact you personally? Does it impact someone you love? Does it impact where you live? Does it impact where you work or study or play? What research can you do? Now that you've figured out the issue that lights you up, now that you've figured out your personal connection to it, what research can you do on it? Who's doing this work already in the community? How can you plug in? What community do you belong to? We talked about identities, or I talked about identities earlier in this presentation. Are there communities of Latinas or Latinos that I might want to join with who also care about the issues I care about? I'm an East Sider. Are there East Side neighborhood associations? Are there East Side organizations that pull around the collective identity as East Side San Jose residents that I can plug into? I'm a mom. Are there parent groups? Are there mom groups? I'm a daughter and a sister, right? Are there groups that I can identify that work on issues through that lens? Or maybe there's communities that I haven't even thought of yet that I might belong to. When I think about the issues that are important to me, can I find out who's doing that work? What communities are collectively, and they don't have to necessarily be those identities. I organize communities of patients, right, who organize around the collective identity of being patients. So think about what communities and circles and networks do you belong to? What are you already a part of? Are there some out there that you can join? Are there individuals within those networks that you can meet with to learn more about this issue or more about what's happening? Are there opportunities to volunteer with local efforts or local organizations? And I'll just throw this one in there because I really hope that bright, amazing students from San Jose State are thinking about appointed or elected office. So should I run for appointed or elected office? Is it also another way to be thinking about advocacy? So that's advocacy as a volunteer, although running for appointed or elected office can certainly be a career. But advocacy as a career. So now that you've thought about and you've done some volunteering and you've thought about what are the issues that are important to me, what are you passionate about? Do any of these volunteer opportunities spark passion for you, joy for you? What's the impact you want to make? What's the legacy you want to leave? What's the work environment in which you can thrive? And what setting would you like to be? Nonprofit, public policy think tank, elected appointed office, government, for-profit campaigns, organized labor. There's tons of opportunity. There's a million ways for you to deepen your advocacy and formalize yourself as an advocate. You just have to think about what would make you happy, what sparks that joy, what's the impact you want to have, and in which systems do you want to make a difference? And then think about if you can get an internship there. For me, it all started with a pothole. So this is on the left here, you see a picture of students at Joseph George Middle School. This was a picture I took off of the internet. This is not me in there, but imagine me this little and this age. And I was a student in middle school. And this on the right here is my middle school, Joseph George Middle School. And right in front of this middle school, there was a pothole that was causing harm, it was causing cars to swerve. It almost hit a student. This pothole was just really disruptive and dangerous. As a student group, we decided we wanted to do something about this pothole. So we organized ourselves as students, and we started doing the research about how we might fix this pothole. We started having these meetings, and we did get the pothole fixed, and that's actually a good moral of the story. It was fixed eventually, but not during this year, because sometimes advocacy takes a long time. But that feeling of knowing that I, as a middle school student in East San Jose, had the ability to meet with public officials, to coalesce and organize students. We were interviewed by the news. We had all of this attention around this pothole and the importance of getting this pothole fixed. And in the flyer, the handout that I gave, there's some quotes on the side that I really love. And the bottom quote there is a quote from Cesar Chavez, and it says something like, it was never about the lettuce or grapes, it was always about the people. So my first lesson here was that it's not about the pothole, right? It was about the students. It was about the people. And for me, I just became in love with the idea of centering people in this work, and that I could, as one individual in partnership, in coalition with other like-minded folks, could move a needle somewhere. Eventually the pothole did get fixed. We moved the needle on it. We brought attention to it. We talked about the pothole in the context of students deserving a safe place to go to school, students deserving to be able to walk to school, skateboard to school, bike to school without fear of being hit by a car, without fear of their physical safety. Parents deserve to be able to send their kids to school without the fear of their child not making it back. It taught me a lot about effective advocacy, why advocacy matters, and how advocacy can help the smallest group of people. Effective advocacy, organized advocacy can help the smallest group of people, people you wouldn't normally think would have such a big voice, to be able to move those mountains. And it also helps to shift the power dynamic that is inherent in politics and government. Then my advocacy grew. So I got involved in an organization called PACT, which is an organizing group. I was a youth organizer, and we started doing some neighborhood projects, right? We, as young people, we had this empty lot, and we looked around East San Jose, and we thought, man, there's no, this was when I was in high school at James Lick High School, there is no youth center for youth here in Alum Rock in East San Jose, and that's not right. And so we started advocating, and finally we got this youth center built, and I'm really proud of it. I pass it when I go home. I live in Alum Rock. And when I look at this youth center, I remember that this was a group of young people, high school students in East San Jose, from the schools of Overfeld, James Lick, and Mount Pleasant, and Independence, who came together to make demands of our city government, demands of our budget, demands of resource allocation, and through advocacy, effective, constant. I was 15 when this project started. I was about 21 when it was built. So constant, relentless demands and effective advocacy this was a huge project that was actually built. This picture on the right here is a library. There used to be nothing but liquor stores on this corner in my neighborhood. And we started doing some advocacy and organizing around wanting to have less liquor stores and a bigger library and a more state-of-the-art library. And I share these stories with you to say, as a young middle school and high school student, I was able to help move the needle on this in coalition with other people, and advocacy works. It is in fact probably one of the only things that works. And then my advocacy continued. So planned some marches, did some swearing in, became president of the County Board of Education. That's really involved in politics. And then did some national advocacy around young elected officials. So my career from that pothole and sparking that, even though the issues that I advocated for, and a lot of the advocacy here were around women's rights and public education and civic participation, and a lot of other issues that come into that. But it started with that pothole. And what never changed for me was centering people. The issue areas have changed a lot over the 20 years I've been involved in our community. But what hasn't changed for me is centering the people who I see when I walk my neighborhood, the people who I see when I go to work, the people who I was in community with at school, and centering whatever issues it was that was important to us in my advocacy efforts. Oops, sorry, go back here really quick. Sorry about that. What I love and what challenges me about advocacy. Well, you heard the things that I love. I love everything about advocacy. I love knowing that it is an effective tool that I can go back to. I love knowing that it is a blueprint for the way that we can engage with complicated, sometimes racist systems. I love that it's a way that we can shift the power dynamic toward people, toward the vulnerable, toward the underserved, toward the underrepresented, that you can even the playing field through effective advocacy. I love that you can topple and dismantle systems that are harmful through effective advocacy. What are the challenges? As you heard in the other story, I was 14 when we started working on that Allen Rock Youth Center. I was 21 when it was built. This is long haul work. Sometimes you'll get something done quickly, but big changes take time and sometimes generations. So being able to have that discipline and patience to know we'll have small strategic wins along the way, but sometimes you don't change whole systems overnight, and sometimes you may not even change them in your lifetime, but knowing that it all makes a difference. And then the other challenge is making sure that you're constantly growing, and as you're moving along on your path, just remembering to center those who are not quite that far or are still being impacted as you start to gain more of your privilege. So how I became a health advocate. Now I'm pretty centered on health advocacy. This is a picture of my father. I was working at Kaiser Permanente, so I went from working in the legislature to working in government community relations in Kaiser Permanente, where I did lots of advocacy around public health issues and issues of health in general. And in the middle, right after I had went on maternity leave at Kaiser and I had my son, well, the minute that I was there with my son in the labor delivery room, my father clinically died in the same hospital. And it was just a terrible experience and a really awful time. And a lot of it had to do with flaws in the healthcare system and capitalism that exists in the healthcare system and the principles of capitalism, the capitalism that exists within the healthcare system. A lot of it had to do with social and economic inequities existing outside of the healthcare system, and just recognizing how much all of those social injustices really led to, sorry, 1 second, okay, really led to his experience within the healthcare system. So I decided that because I was doing so much patient advocacy on his behalf, along with my sister in his healthcare plan, I decided that I was going to go to be a patient advocate at Latinos Contra Cancer. I'm just going to move one. Thank you. And so I took this job at Latinos Contra Cancer as their CEO, taking over for the founding CEO. And it was an amazing experience to marry all of the advocacy experience that I had up to that point with my experience in healthcare, but to serve the underserved in healthcare, to serve the low-income Latino community, to serve my neighborhood, to serve people like me, the people like my family, the people I had always served, just in the capacity of healthcare. And I used my personal connection to the issue. I talked earlier about what's the issue you're passionate about? What's your personal connection to it? I advocate every day around health advocacy because I have a personal connection by way of what happened to my dad, and by way of, and he's well and good now. But his long battle and experience through the healthcare system is my personal connection to health advocacy. And it's why I do the work that I do today, and why at LCC, we're an organization that exists to create equitable and just access to the healthcare system. And I do that with so much passion because I've lived that experience too. So what has changed over the past year in public health? Well, certainly for those of us who have been working in the public health space or have been working in health advocacy, we were not surprised by how disproportionately this past year impacted low-income communities, communities of color, in this county specifically the Latino and Black community, because it's been that way in health even before the pandemic. The pandemic deepened health disparity for the communities I just mentioned. The pandemic really put in your face the grave economic and racial disparity that exists within the healthcare system, the completely unnecessary, predictable, preventable flaws and negative outcomes as a result of the inadequacies of our healthcare system were very much put on display during the pandemic. So when I think about what has changed, I'm hopeful that what has changed is a realization that we cannot go back to a healthcare system that existed prior to the pandemic. We cannot go back to a healthcare system where so many people en masse can lose their health insurance because they've lost their job. Or we cannot go back to a healthcare system that remains inaccessible to the most vulnerable, the most impacted by a mass virus, by a pandemic, by a chronic condition, that we can't go back to a healthcare system that remains unaffordable and inaccessible for those who need it the most. So I hope that because so many of these disparities were brought to light because of the pandemic, that the shift in narrative has been, we have to create a better healthcare system that serves people, and the regardless of income, ethnicity, documentation status, language. And the second narrative shift around that will be because it's good for public health to do that. It makes sense for public health, and it also makes economic sense, because when people didn't have access to insurance, when people didn't have access to healthcare systems, when people couldn't take off work because they were sick during this pandemic, when people couldn't isolate during this pandemic, when we didn't have a robust enough healthcare system to manage all of this, it also impacted our economy greatly. So for me, the narrative shift there would be, we need to create a healthcare system that's universal and that serves all people, regardless of those different indicators that I mentioned. And we also need to do that because it's good for everybody when we do that. It's a moral imperative, it's an economic imperative, and it just makes a lot of sense for public health. It's solid public health strategy. What are 3 things you can do this week in support of public health? So this week, vaccines are a really big topic right now, obviously. We know that in this county, the Latino community is still lagging very behind in the vaccinated population. So one thing you can do is educate yourself about the vaccine and educate your families. If you have family members who need myths dispelled for them, if you have family members who have heard misinformation or have questions, help them to learn that information, help them to become more knowledgeable and aware of the vaccine, and become their advocate in getting an appointment. It's one space where you can test out the advocacy skills that we've already established you already have, and advocate for members of your family to get the vaccine when they're eligible. And at this point, we're really rapidly moving toward the space where everybody's going to be eligible. The one setback we have is not enough vaccines, but hopefully that will change soon. So if you can be your own advocate and an advocate for your loved ones during this time and making sure that they are staying safe and healthy during this pandemic, and also that they're accessing the vaccine when they can and in places where they can. That's, I guess, one thing you can do. Maybe that's a few wrapped up into one. But another thing you can do is start this week and research how you can get involved in these public health efforts. Right now, COVID recovery is a big issue, not just health-wise, but economic recovery. And you cannot separate public health from social inequality or economic inequality. They are linked. You cannot separate them. So you can start to look at right now, what are the issues that you're passionate about within the context of the pandemic? Is there something you want to advocate for? Is there a piece of this pandemic, the piece of COVID-19, a piece of the vaccine rollout that fires you up, either because you're excited about it or because you're really angry about it? And think now about, is there an agency I can volunteer with? Is there a way I can be helpful? Is there a way I can do my own work in my own neighborhood or in my own community in which I am a part of? And start to lay that groundwork now. There's nothing stopping you from volunteering for any of those issues that you might be passionate about. So advocating for your loved ones and yourself around getting the vaccine and COVID health in general, thinking about the issue that is firing you up, either because you are in support of it or because you really don't like it, in the context of vaccine rollout or COVID-19, and researching how you might get involved. And then the third, I think, is thinking, actually, I'm going to leave it at those two, because I think those are probably the two, but I want to focus on those because those are really the two best things that you all as brilliant students can do right now. And there was a question around advice to younger me. So I thought about, what would I say to younger me? And I'll go through them. So one thing I've always told myself since I was just getting involved in this work was, there are no gatekeepers. In this world of advocacy and in systems, there are a lot of false gatekeepers. And it's important to remember that in your professional life or even in your personal life, there are no gatekeepers, right? It's you, right? You through hard work, consistency, coalition building, are your own gatekeeper. Resilience is a key quality of a leader. Embrace it. I know that my parents have always taught me to be very resilient. As a Latina in East San Jose, you face, and all of us will, regardless of where you live or your ethnicity, we all face setbacks and disappointments and failures. I've certainly had my fair share. And resilience is what makes a leader, not perfection, not never experience setbacks, not always achieving. It's those failures, it's those setbacks, it's those potholes, right? That build, that teach you, that bring you your lived experience, that bring you your wisdom, that make you a more effective advocate with personal connection to these issues. So embrace that resilience. You are more talented and capable than you realize, I promise you. However capable and talented you think you are at this moment, I promise you, you're 10 times more talented and capable. And you may come across people in your careers, academic, professional, other pieces of your life that may tell you otherwise, but you have to know for yourself. You are very talented and capable. Believe in yourself the most. You have to believe in yourself the most, especially if you're going to do this work. Anything and everything is possible. That is true. It is, anything and everything is possible. If you can dream it, if you can believe it, you can achieve it. Your thoughts are very powerful. Control your thoughts. They are very, very, very powerful. Really be mindful. Practice mindfulness in your thinking. Incorporate that as a practice, particularly if you want to go into advocacy. You have to be able to believe in something better. You have to be able to believe in something that doesn't even exist. You have to be able to envision systems as they can be and not as they are now. In order to be an effective advocate, you have to be real, but also optimistic and hopeful. And so that anything is possible and your thoughts are powerful go hand in hand, because you must believe anything is possible and you have to control your thoughts around it. Be kindest to yourself. Advocacy is tough work. You're not going to do it all right all the time, and be kind to yourself. A job cannot be loyal to you. So this go hand in hand with the bottom here. Prioritize your health and your happiness. Prioritize that. And then finally, just go for it. That'd be the final piece I would say to myself. If you're wondering whether you should do it or not, just go for it. And that is the end of my presentation.
Darcie, thank you so much for sharing such inspirational words and advice and your journey. I was completely emotional during your entire presentation, just because you bring so much heart into everything that you do and that what you've been able to make possible. So thank you very much. We're going to go into the question and answer period of this webinar today, and you have a couple of questions so far. I'm glad to see that I wasn't the only one who was emotional. I see some comments. One question was, what were some of the health issues that you advocated for when you became a patient health advocate? From Omar.
Yeah. So as a patient advocate, so, it started with my dad, right? And so some of the issues that he faced were around losing his insurance while he was managing his chronic condition, because he lost his employment because of managing the condition. That is actually very common that we see happen with the clients that we serve at Latinos Contra Cancer, is that you would think at the moment when you need your employment and insurance the most, right? Because you have become either permanently or temporarily disabled because of a chronic condition or a disease or something that has happened to you. But your inability to work is what can trigger your loss of employment and then your loss of insurance. It is wicked, it's awful, it is just backwards. That's something I deal with a lot, is helping people navigate that. Another might be medical bills. So many people don't realize, one, that there might be avenues to get their medical bills lessened, that maybe their medical bills are a mistake, and so many other ways you might be able to negotiate that. For a community member who is already dealing with the stress of poverty, the trauma of poverty, the trauma of this pandemic, the trauma of a disease, advocating for themselves with a medical biller or an insurance biller is not fun. It's overwhelming. It can just cause them to shut down. They'd rather just go into debt and pay it. So I have a particular like for going toe to toe with medical billers, and many of them are very helpful, I have found, actually. So that's another area that we do a lot of advocacy. And another might be in the area of translation and helping people to access healthcare in a way that is culturally and linguistically what they need. So those are some of the topics that come up. Some other things also might be around just like getting quality care, access to a different physician, navigating the healthcare system. And then lastly, for people who are suffering from other types of social inequities through while they're dealing with the medical crisis. So loss of housing, inability to access food, those type of things that you need to have in order to be able to deal with the medical crisis.
Excellent. Thank you so much. We have another question from Erika Pagan. She says that she loves seeing everything that has been accomplished by your advocacy, but she's curious on how to bring attention to issues that you find around your community. How do you start advocating the issue and continue to push for change?
So, social media has made, it's like everybody, we all have our own platforms there, right? And we all have people who are in our online communities. That's one way, right? Petitions are good. Videos are good. Bringing together some friends, right? Over a Facebook Live or over Zoom or over any of these platforms to talk about the issue. I would start by, if there's an issue you're passionate about that you want to bring attention to it, do all the research on it, right? Again, so you know who's doing it. So maybe there's an issue, like maybe there's like, I'm thinking one in my neighborhood right now around a stop sign, right? So maybe there's something in your neighborhood that you see you want changed. is there a neighborhood association that already exists? Can you show up at this neighborhood association and bring this issue to their attention and find out if they want to help you on it? Are there other people that might be interested in helping you on it? Can you pull together a little team of people, of your friends or a couple neighbors or your parents or a sibling? It's coalition building. Do the research on it. Who else is doing it? Can you do it in coalition? And then the final, well, not the final, the other steps too, but ultimately in effective advocacy, whether it's a small issue or a big issue, you always want to know who has the power to change it, because you don't want to spin your wheels on an area of the system that can't help you anyway. So one of the first steps, and I probably should have put that in the slide, but one of the first steps is understanding who has the power to change it. So if it's the city council, that's a whole path. If it's your neighborhood council or your HOA, that's a whole path. If it's your library system or your school, that's a whole nother path. So do the research to understand who ultimately has the power to do what you need.
Thank you, Darcie. And thank you, Erika, for that wonderful question. Omar has another question. Were there any challenges that you faced while trying to advocate?
Yeah, we would need a whole nother Zoom. I will leave my information, and you all any of you are welcome to reach out to me at any time. I love talking to students, so I will leave my number and email in the chat, and you guys can all, if you want to talk in depth more about any of these things. But some specific challenges I have had is not so much at this point in my life, although still in some settings, but when I was younger, definitely being young and standing firm in your ground. I think that's why whenever you start to feel like, do I belong here? Am I being marginalized? I've certainly had that experience where I say something and then it's the exact same thing as maybe said by a man, 10 minutes later. And they're like, that's a great idea. I'm like, I just said that 10 minutes ago, but I guess, coming from me, it didn't sound the same. So, patriarchy, white supremacy, those things exist and they have been challenges. Not things that keep me from moving things forward. Not challenges. The only thing that keeps me from moving forward is me, right? But because there's no gatekeepers. But if you ever start to feel like that, I would go back to advice to younger me, keep that in your pocket and just hear my voice telling you you're brilliant and enough. But yeah, just dealing with when I was younger. And then also, what you don't know, right? It's just the learning. Learning as you go. There's trainings on being an advocate. There's lots of trainings and things you can read. But at the end of the day, this is a hands-on sport, right? So you learn on the go, and I've made mistakes. There have been times where my advocacy wasn't as effective, or we didn't win a campaign, or we fell just a little bit short. And so remembering that this is long haul stuff, right? That this is systems work and movement work and social change work is lifetime work, brings you that comfort. But the challenges were really around dealing with those systems, that the same systems I'm trying to impact, I'm impacted by them too.
Thank you so much, Darcie. Darcie, do you mind stopping screen share though for a moment, if you don't mind? Sorry. Thank you so much. So another question that you have, and thank you so much for answering that. I think it's so easy to look at somebody and say, oh, they've had all these wins. Do you know what I mean? And sometimes part of our success is all the failures and bumps along the way. So thank you for sharing that. I have a question from Christopher. Were you told that you shouldn't advocate so much when you were younger in order to keep out of trouble?
Like to not get in trouble.
Yes.
Through advocacy.
Mm-hmm.
Yes. Yeah. I even now, my advocacy has only become more radical as I've grown older. So, even now you kind of get the like, is that the way you want to advocate? And what that tells me is I'm in the wrong circle of advocates, right? So I gotta find a circle of advocates and I'm in the right circle of advocates now. But certainly as I was younger, you deal with patronizing and condescension, but I think I'm trying to phrase like what I might say to that. Yeah, I mean, but I also I did have some folks who were just like, you know, why do you want to do this work? Or people maybe who like might be even your friends and family, like, why do you care so much? Why do you want to get involved in this? They're not paying you to do this. It's all volunteer. Why are you doing this work? So you really have to find the passion within. I will say though, I sought out and found a lot more encouragement than I did pushback or negativity. So I think that's part of the resilient piece, right? Is and I was joking about it just now, but really I'm pretty serious about it. If you're finding that your circle is not going where you're going, and that's something you're passionate about, then look for other circles too. I'm not saying you have to get rid of that circle, but you know, also think about what communities am I in, and do I need to be in other communities too, so that you start to get like-minded folks and you get that encouragement, because there are going to be plenty of people in whatever you want to do that are going to be naysayers, who can't see the vision that you have, right? Who can't see the world as you want to see it, who can't see a world without injustice, who can't see a world without social ills, who don't see it like you see it. And they will be naysayers, right? And will try to just dampen what you're doing. And so it's really up to you to be able to know why you're doing it, and to have that resiliency, and to find the people who are in that space too, to not allow yourself to be so impacted by that.
Thank you, Darcie. And thank you, Christopher, for that question. I have another question by Yesenia. How can one who may not directly be affected by a system be a good ally to those who are?
So I mean, there's allyship, right? And then there's like, you know, there's these terms around like co-conspirator, and you know, how do you show up for people when you aren't the person being impacted? And that's really, allies are really important. And we saw that a lot this last year, right? Where folks who are not being personally impacted, but still showing up at marches, still donating with their time and their money, posting on social media. I'm going to give an example of a terrible, this is actually an example of it not being done right. And it's a current example you all should look up, and how not to advocate. This just happened in the city of Santa Clara, I believe. A council member there held a rally for the API community, a Stop the Hate rally that had been happening right in this valley. And this council member was not API. And the one council member who was on the city council, or is on the city council, who is API, shows up at the rally and asks to speak. And on Facebook Live, and this got lots of news coverage, so again, I encourage you to look it up. That council member who organized the rally, who was not API, tells the API council member he couldn't speak, and that it was her rally, thanked him for coming, and moved on. And of course, this sparked lots of outrage. We signed on to a letter, LCC, and there's a letter being circulated, right, around censuring this council member. And so that was her, right, being an ally, right, planning a march or a protest or a rally, speaking, organizing the rally, doing all the hashtags, doing all the Facebooking. But do you remember like bullet number 1 under my why do you advocate? It said centering the impacted people, right? Centering impacted voices. I run an organization, Latinos Contra Cancer. The people we serve are primarily Latino, low income, and many are undocumented. I am a Latina. My income is not great. It is not low income like the folks I serve. I am not undocumented. I speak English. I was born here. I am not, centering me is not centering the clients that I serve, even though I am Latina, even though I live in East San Jose, even though I've experienced racism and discrimination, even though I have experienced hardship within the healthcare system. It is up to me as an ally of the clients that I serve to center them. So being a good ally to me and showing up for people means if you're at a space and you don't see the people who are being centered, Like, excuse me, where is so-and-so? Where is this voice? Where is this stakeholder? I refuse to continue with this process until these voices are at the table, right? And doing that in all aspects. And then making sure that when you're posting on social media, when you're, holding whole rallies, and when you're doing these things, that it's not performative, because you're centering the voices of the people who are impacted. I also talked about advocacy, meaning actively creating space, right? So just think like visually, think about like when we're advocating, we're creating a space. And who goes in that space? So as an ally, you can create the space. Doesn't mean you should be the one filling the space though, because the space should be filled with the people who are being impacted.
Thank you so much. I think that is so powerful, and I really appreciated that concrete example. We have a series of questions that have been asked by several people, Chioma, Guadalupe, and Maritza, kind of around like, how do you encourage yourself, to keep on going? What advice can you give to someone that might consider giving up while trying to advocate for some issues? So kind of all in that vein is keeping that passion for advocacy alive.
Gosh, that's like such a big question. That's a great question. Those are good. That's a really good question. I practice self-care radically. And there's a great Audre Lorde quote that I'm not going to say perfectly right now, but it's one I have up in my office. And it's about self-care not being self-indulgent, and that self-care is an act of political warfare. And what I take from that quote, and when I think about that quote every day, I realize that as a Latina, I live in a system that expects me to wither on the vine, right? That expects me to succumb to all of these social inequalities and social ills that I'm battling against every day. Like there's an expectation that the system always wins, right? That the system is rigged and it's always wins. And I owe it to my community to be in it for the long haul. I owe it to myself. I owe it to my family. I owe it to my son. I owe it to my ancestors, right? To survive, to thrive in the face of all this. And so how do I do that if I'm burnt out, right? How do I do that if I'm not caring for myself first? And so I don't view, and however you do self-care is a personal decision, right? I mean, for some people it's getting your nails done, that's fine. For some people it's meditating, for people it's yoga, whatever it is, right? With some people it's just having a nice meal with your family. Whatever your self-care is, get real and serious about it. Like I protect my self-care. It is a priority. It was in my advice to younger self. I would have done it more when I was younger. I think I value it now in my 30s. I take it very seriously because I want to be in this for the long haul. Like I want to see the systems change and I want to be a part of it. And so that I keep going because I feed myself first and I don't try to pour from an empty cup. And I do that because that's my defiance. And so I attach my self-care to my advocacy, right? Like my self-care is my defiance. It's my raised fist against the system. And I'm not going to allow the system to, dampen my, my efforts. I'm not going to allow the system to push me into the ground. So I'm going to practice self-care so that I can show up every day as my full self with all of my identities and all of my experience and able to fight another day. And I don't view it as a self-indulgent at all.
Thank you, Darcie. I think that's so powerful because I think sometimes the communities that we come from kind of tell us that, self-care can be selfish, right? And like really kind of claiming that and reframing that in a way as a way to take care of ourselves in order to be able to do the work that sustains us. So thank you so much for sharing that. And then I think one of the last questions that we have here are there any books or podcasts that you recommend around advocacy or health disparities, like any kind of suggestions that you have?
I'm reading two books. I have so many book suggestions, but I'm reading two books right now. One of them is called Just Medicine. The name of I have it right here. Maybe I can email out the name. But it's a book on health disparities. And what I like about it is that as a health advocate, it's important for me to understand. I see every day real time health disparity. Like I don't really like that word health disparity. It's so passive and polite. It's health injustice, right? The disparity is like the cute way to say it, but it's health injustice. And we see this happening every day. But in order to change that into the kind of systems work that I want to do and the mobilizing of impacted clients that I want to do, I have to really understand why it exists and the racism that was baked into the founding of our healthcare system, and as a way to understand why it's so difficult to overcome the issues in our healthcare system. So Just Medicine is a book that explores that topic. And the other one that I'm reading is We Do This Until We Free Us. And this is a book about abolition strategy. It's actually almost like a how-to around abolition strategy. Even if you're not an abolitionist or that's not your issue area, I think there's a lot of wisdom and tactical ideas in there around this idea of coalition building and grassroots advocacy. I've just started it, so I'm not as far into it as Just Medicine as I am, or as I am in Just Medicine. But it's another book for advocates, and I would encourage you to think about the issue area you're most passionate about, and then just start to research like who's doing social justice aimed work in that space. Follow those people on Twitter, right? And see what books they're writing, and just start purchasing those or renting them, or digitally from your library, and following those folks that you want to learn more about on Twitter too has been really helpful. But those are the two books I'm reading right now. I mean, I'm sure I could think of a whole host of others, but those are the advocacy efforts that I'm involved in currently.
Excellent. Thank you so much. I honestly can't thank you enough for taking the time. I know that you're really busy because you're busy advocating for lots of things in the community every single day. But thank you so much. And thank you for putting your email in the chat. I'm going to hand it over to Dr. Buckner to close us out.
Thank you, everyone. Thanks, Dr. Gomez and Darcie. Thank you so much for your time today. We appreciate you so much for your energy, your commitment, all of the work that you're doing. And to acknowledge everything that you're doing in our community, we want to present you with the first ever from our department Public Health Hero Award. You can add it to your list of all of the many recognitions that you so clearly deserve. And we will send this off to you with a little token of our appreciation. I know that it's not much, but we want to acknowledge that what you're doing for us and our department and our students and then our community is just exceptional work. And we cannot thank you. We cannot thank you enough. So we appreciate your time today. And students, thank you so much for coming. We're so happy that you're here. And we hope that you take some of this to heart and you find some ways to advocate in your community, figure out what you're passionate about, and just do it. Just do it. Thanks so much, everyone. Appreciate you being here today.
Thank you, everybody.
Thank you, Darcie. Thank you, everyone. Incredible.
I think maybe also real quick, folks have been asking about the recording, so we'll make sure that we have a recording that's available, hopefully within a week, and we'll communicate that just via the department email.
And the flyer that I passed out also had other agencies and some resources on there too, so I can.
Perfect. So I'll post before we close out. I'll post one more time in the chat the link to the flyer, but I'll make sure that that flyer is available in a few different locations.
Thank you, everybody.
Thank you.
Thank you so much, Darcie. Have a great rest of your day.